Hi, good morning. Today I'll be discussing about peer-assisted learning. So, what exactly is peer-assisted learning? Especially in medical education, it is quite important because most of the things we learn from peers. So, who are those students? Either who are those peers? Either it may be students or your near peers from where you can learn. So, what is this peer learning? Peer learning is students learn with and from each other. So, actually, we are moving from the traditional teacher-led instruction towards the peer learning, where we can get collaborated with the knowledge, skills, and experiences for better participation, critical thinking, and understanding. So this peer learning can involve learners at the same level or the nearest peers like seniors or juniors. So what exactly you are going to do here is you can discuss the concepts, teach each other, solve the problem together and give the proper feedback. So what is the role of a teacher here? Teacher actually is just acting as a facilitator. He is not the sole source of the knowledge. So how does this work? This helps by creating a mutual understanding, especially the concepts which can be understood very well by explaining to each other. Next thing is a facilitated environment where the teachers can guide and support rather than solely impart knowledge here. The third one is the shared responsibility. So each and every student who is a part of this will take active role in the learning process. So what are different types of peer learning? So there is something called as peer teaching. Then we have got peer discussion, peer assessment, peer tutoring, and near peer learning. So in peer teaching, one student teaches the others. In peer discussion, group discussion of cases or topics occurs. And in peer assessment, student assess each other's work, how they are performing. Peer tutoring is more knowledgeable peer. Somebody who is more knowledgeable can help others in doing it. Near peer learning is seniors teach juniors. Okay, this is very effective. Even in my personal experience, this is one of the best method is near peer learning. What is the importance of this peer-to-peer education? It is going to improve the conceptual understanding. It encourages active learning. It develops communication skills, reduces fear of asking questions, builds a teamwork and professionalism, and enhances retention and even the clinical reasoning with the students. Peer-to-peer learning in the classroom. Okay, so it can be of two types. One is called as the formal type, other is called as the informal type. Formal type students will be taught by their seniors. Informal, they go along with the same batch where they are going to discuss and share their thoughts and views. So what are the advantages of peer learning? You are going to gain new perspectives. What you are not able to understand, you can get a better perspective. Build networks, so more number of people get along with you, so you come to know around the people and you can build the network. Okay, increase engagement by doing this. Each and every person will be engaged in doing this study. That is another advantage. Improve communication skills. Okay, so when we are in the group, we always learn how to communicate with each other. So it is going to help in improving the communication skills. And you can create a feedback loops where one person can give an immediate feedback. So where and how you went wrong, so that you can learn as quickly as possible and accelerate learning. So the learning process is much faster because it is the student led learning process, so they will learn at a faster pace. There are some advantages. It also has got certain disadvantages. The main disadvantage is dominant students may overshadow others. So very few people, when they are participating, if they dominate, okay, so the real purpose will be lost. Requires clear structure and objectives, because without clear structure and objectives you cannot have a proper discussion. Sometimes they also have got certain misinformation which will be transmitted to others also. So that has to be monitored or controlled by the faculty. You can come across certain social issues because the acceptability by each and every person or understanding will be very difficult. Then improper expertise will be there. Okay, so they are not completely expert in that particular area, and a lot of distraction. One person can be distracted by the other, and the time consuming. If it is not done properly, it will be more time consuming. How to implement this peer-to-peer education? Create a positive environment, create a network opportunities, encourage others, keep the feedback and keep track of this, and smooth conversation has to be done. So what is the role of teacher in learning? He is going to set clear goals, correct the misconception, provide guidance and supervision, encourage equal participation and assess the outcomes. Some of the examples in medical education is small group case discussions where they can get involved with the peers, peer feedback on history taking or counseling skills where they can give the immediate feedback where they went wrong. Students also can assist in developing by doing a role play, especially doctor-patient communication, and the seniors can demonstrate the clinical examination to juniors which they can learn better. Okay, so there are certain potential challenges. If the group quality is bad, effectiveness relies on knowledgeable peers. So if the quality is not good, you are going to face the problem. Unequal contribution, if only few are contributing, others are not contributing or dominating, the group will be poorly formed. Next is the learner comfort may not suit everyone, especially those uncomfortable in the group may not be